You hear a dietitian talking to a patient called Carina Bretby. Carina Bretby. For questions 1 to 12, complete the notes with a word or short phrase that you hear. So this is OET Listening Part A, Extract 1. And the name of the patient is Carina Bretby. And this is a consultation with the dietitian. This is the consultation with the dietitian. Okay. Now let us study this. Okay. So you hear a dietitian. So this is something related to diet. Now, we notice that this is a consultation of a patient with a dietitian. The name of the patient is Carina Bretby. So it sounds like a feminine name. So Carina Bretby. Right. And this is the name of the patient. So this is a dietitian related or dietetics related topic. And you have 30 seconds. These are the three important things that you have to notice. Now, who is the medical professional? Now, three things we have from here. First one is the medical professional. Who is the medical professional? So who is the medical professional? Number one. So you understand who is the medical professional. And you also have to know who is the patient. Okay. Who is the patient or the patient's caregiver. Right. And what is the specialty? Okay. What is the specialty or what department it is? What department, medical department it is. So these are the things you have to notice. What is the department? Dietetics. You hear a dietitian. It is related to dietetics. So now what more we can guess? The time. So this is the time allotted. Okay. Time allotted for pre-listening. Time allotted for pre-listening or brainstorming. Brainstorming. Time allotted for pre-listening or brainstorming. So these are the three focal areas that we are going to study now. So first one is who is the medical professional. Second one is who is the patient. And third one is which department related subject it is and how much time it is allotted. So now that's clear. Dietetics. And the name of the medical professional is dietitian. The name of the patient is Carina Bretby. So because it is here, you see, patient. Okay, Carina Bretby. And the time allotted brainstorming is for 30 seconds. It is for 30 seconds. Right. In these 30 seconds, you have to analyze 12 questions. So 12 questions. Brainstorming 12 questions. So you have how many questions? 1 to 12. 12 questions. How much time? Time. Okay. For 12 questions. Okay. Time for 12 questions is equal to 30 seconds. 30 seconds. So time for one question is equal to 2 0.5 seconds, 2.5 seconds, 2.5 seconds. Each question, you have to allot only 2.5 seconds. That's all. So this is the time constraint you have to focus on. This is the time constraint that you have to focus on. So once again, who is the medical professional? Dietitian. And therefore, the department is dietetics. Specialty is dietetics. Then, who is the patient? Patient is Carina Bretby. Carina Bretby. So from this, you can understand that this is a female patient, most likely, because Carina or Carina is mostly a female name. So the patient is female. So female patient. So that's what we can deduce based on the name. Some names we can analyze. Okay, some English names we can analyze. So the patient is a female. That's what you have to deduce. If this is a female patient, then the medical professional should be a male. So dietitian is male. So that's what you have to analyze. So male. So most likely, because Karina is a female name, so the dietitian is, so every medical consultation, one will be a female and one will be a male. One female and one male. You have to remember these two things. Right. That's very clear. Okay. Now, this is what you have to do in the beginning. When you see the test, immediately you have to think about this. The full screen. So, the instructions. The instructions. So we have studied the instructions part. Next, we'll go to the next slide. Here it is. Yeah, this is slide 1. Come on, go through these questions. Go through these questions 1 to 7, because we are going to discuss these questions now. Yeah. So this is the first slide. So based on this one, you will understand what is the topic about. These are the questions 1 to 7. And then you have next set of questions. So 8 to 12 questions. Yes, now let us analyze this particular question set. 1 to 12. Now, if you see very carefully, yeah, surgery for dash 10 years ago. Surgery for dash. For surgery is a noun. For is a preposition. So the next one will also be a noun. Surgery for something. Surgery for something. So some medical condition. Some medical condition. Surgery for some medical condition. Right. Surgery for what? Surgery for some medical condition. Yeah. What might be the medical condition? What might be the medical condition here? Surgery for dash 10 years ago. What might be the medical conditions? Answer options. Okay. Answer options. Okay. Yo. So go procedure to find that, guess the answer. Procedure to guess the answer. So you can guess the answer. One question. Give me your answers. So, number 1. Okay. Answer for question number 1. Procedure to guess the answer. for question number 1. Yeah. Now, if you see, identify the category of information. The blank comes after surgery for. So blank is coming after surgery for. Okay. So focus on this one. Surgery for some medical condition. Some medical condition. So this is a structured method for finding out the answers. So first step is you have to identify the category of information. Number 1. So it is a medical condition or a body part problem. Surgery for a body part problem. Okay, removing ulcer maybe. A specific type of surgery name. So it cannot be an adjective. It cannot be a symptom. It cannot be a treatment. It cannot be a food item. It cannot be a lifestyle factor. So the narrowing the field, the name of a condition requiring surgery. So now clue 10 years ago. So that means surgery is done 10 years before now. So it tend to be well known, significant, typical one of common operations. So your brain should scan for what common surgeries adults often mention. So common surgeries adults often mention are number 1. So let us see what are some common surgeries. Let us see the question. For this, let us take the options. Number 1, it may be gallstones. Surgery for gallstones. So removal of gallstones or gallstones removal. You can say like that. Or gallbladder removal. Gallbladder removal or appendicitis. Appendicitis or appendectomy. Appendectomy. Appendicitis or appendectomy or hernia repair. Hernia repair, or you can say fibroid removal. Fibroid removal. This, my mind is going on like this. Fibroid removal maybe, or ovarian cyst removal. Ovarian cyst removal, or it can be sinus surgery. Sinus surgery, sinus surgery for sinus. Okay. Or tonsils removal. Tonsils removal. So it is adult. So less common in adult. Tonsils removal. Next, varicose vein. Varicose vein surgery. So these are some strong guesses. Now let us see. If you see, it should be one word. Okay. So now listen for two-word condition. So listen for a two-word condition. Okay. Now 2 words. Appendicitis is one word. Gallstones is one word. Tonsillitis is gallstones. Many people think that gallstones 2 words. No. Gall bladder one word. Gallstones. Okay. Gallbladder. You check gallbladder is one word or 2 words. Right? Gallbladder. So you have to check all these things. Then gallbladder is 2 words. Normally it is informal. Gallbladder 2 words. Yeah. So you have to verify how many words you will get. 1 word or 2 words or a compound noun. Okay. Gallstones, compound noun, 1 word. Gallbladder, 2 words, separate, like that. Tonsillitis, 1 word, right? Surgery for tonsillitis. So you have to think what might be the probable answer. Possible correct formats may be ovarian cyst. Okay. Ovarian cyst, 2 words. If there are 2 word answers, you have to write ovarian cyst if it is right. So guess, because she's a female. The patient is Carina Bretby. She's a female. So it is, you can understand, So it may be ovarian cyst or fibroid tumor. You can say fibroid tumor or fallopian cyst or pelvic abscess, or it may be kidney stone, or it may be gallbladder, a condition. Okay. So this narrows your smart guess pool. Smart guess. Now cross-check with the rest of the notes. Cross-check with the rest of the notes. So biopsy for suspected dash 8 years ago. Biopsy for suspected dash years ago. If you see this one, you can see this may be some gynecological issues. So biopsy 8 years ago hints that Carina had some gynecological issues or skin issues or breast issues or gastrointestinal issues. So if you see, this gives a subtle cross-link. Women with ovarian cyst surgery often have biopsies for suspected endometriosis or fibroids. This is a correlated thing, a cross-link, we can say. Cross-link. Biometriosis. Okay, they have biopsy. She had biopsy for suspected dash 8 years ago. So 10 years ago, she had some problem. 8 years ago, biopsy. So surgery and biopsy. After surgery, she also had biopsy. So you can understand very clear. So the cross link is women with ovarian cyst surgery, often later stages, have biopsies for suspected endometriosis or fibroids. So ovarian cyst becomes an even stronger logical guess. Okay, so these are some of our guesses. Okay, these are some of our guesses. Out of that, one logical guess might be, okay, what is this? Ovarian cyst. This might be, okay, ovarian cyst. Maybe chances, okay, more chances. Out of these many options, ovarian cyst is more likely the answer. So we'll narrow down to the first answer, to ovarian cyst. Okay, ovarian cyst, surgery for ovarian cyst removal maybe. Okay, fine. So this is the way how you have to analyze a particular question. If you think like this, it will be easy for you. Okay, so second best logic guesses are kidney stone. So first guess most likely is ovarian cyst removal. The second likely are, so you can say kidney stone. The second best option might be kidney stone. This is the second best option. And gallbladder. This is the second one. And the third one is fibroid tumor. This may be also an option. But the most or the best option is ovarian cyst. This is more likely. So these four options suit properly here. So mentally you have to be faster with these types of analysis. This type of analysis. Right. Then next, we'll go to the next question. This is question number 1. Yeah. Question 1. Okay. Yes. Now let's move on to question number 2. Yeah. So this is question number 2. Yes. Now let's analyze question number 2. Focus on question number 2. Question number 2. So biopsy. Procedure to guess the answer for question number 2. Biopsy for surgery for biopsy for same strategy. Biopsy for something. Biopsy for something, some medical condition. Okay, some medical condition, same style. So here also you'll get a noun, suspected medical condition 8 years ago. So here also same. Suspected for what? Suspected, biopsy for suspected medical condition. Some medical condition. Yeah. Suspected for biopsy for suspected what? Medical condition. Yes. Some medical condition. So 8 years ago. Now you must predict what condition a biopsy was done for. The blanks comes after biopsy for suspected. So it's not a symptom. It is a medical condition. It's not a procedure. It's not a medicine. It's not a body part. A condition is the only correct category. Now, what will biopsy be done for? It will be normally for, so a cancer type conditions. So let us analyze question number 2. So we are focusing now on question number 2. We are focusing now on question number 2. Yes. Now, if you see, a biopsy is typically taken to check for what? Cancer type conditions. Cancer type conditions or abnormal growths. Abnormal growths or autoimmune conditions. Autoimmune conditions or inflammatory conditions, or you can say chronic infections or suspicious lumps or lesions. Suspicious lumps or lesions. Okay, these are some medical conditions which you will take for. Okay, these are some. Okay, you are check for these things normally. Okay, now let us see what might be the various options here. The option might be skin cancer or breast cancer or bowel cancer or endometriosis, or you can say fibroid tissue, or cervical dysplasia. Cervical dysplasia, stomach ulcer, or celiac disease, Okay, so intestinal biopsy. So this narrows the search. Now you can see this is not maybe one word. Is it one word or is it two words? You have to see. Okay, you have to check whether it is one word or two words, right? Now if you understand and link with the previous clues, okay, ovarian cyst or pelvic issues sometimes undergo. So it may be cervical cancer, chances, cervical cancer, or it may be breast cancer, or it may be skin cancer. This is general to everyone, or bowel cancer, less common at younger age. Okay, bowel cancer, maybe. So the most likely options are for a middle-aged woman or young woman. Okay, young woman or a middle-aged woman. The most common biopsies of this age are breast cancer, most likely. Okay, most likely breast cancer or skin cancer, or you can say cervical cancer. Okay, so these might be the options. Now, using the time clue 8 years ago, so at that age, biopsies are most commonly for breast lumps to rule out breast cancer, cervical smear abnormalities to rule out cervical cancer, suspicious skin lesions to rule out skin cancer. All the three are logical. All the three are logical. So, top strategic guess is breast cancer, most likely. So these are all the options you have. Okay, most likely is breast cancer. At this age, most likely is breast cancer. More chances are there. The other second best chances are cervical cancer and skin cancer. So hope the best. So this is how you have to analyze. Okay. Yeah, these are the options for the second question. These are the options for the second question. Yeah. So now third question. Go to the third question. Onset of symptoms, gradual. Question number 3. So we are going to the third question. Now, if you see question number 3 prompt, exacerbated by something and frequent urination. So two things are there. Exacerbated, condition worsened. So exacerbated. So generalized fatigue later combined with sleeplessness, and it is exacerbated, condition worsened, exacerbated by dash and frequent urination. So urination is a noun. Frequent urination is a medical condition. Okay. Frequent urination is a medical condition. So exacerbated by some medical condition and frequent urinization. So here, this is also some medical condition. Exacerbated by some medical condition. So you understand here how the point is going ahead. Some medical condition. And frequent urination. So two medical conditions are there, exacerbated by first medical condition and second medical condition. Second medical condition, we know that is frequent urination. And what is first medical condition? That we have to guess now. So exacerbated. The blanks come from the section called onset of symptoms. Onset of symptoms, and it is gradual. First one is generalized fatigue, later combined with sleeplessness, and that is exacerbated by dash. So what made her sleeplessness worse? So later combined with sleeplessness, sleeplessness exacerbated by dash. So it is an order, progression. Okay, gradually it is happening. So identify the category of information. First one is a cause. Okay, cause. Exacerbated by requires a cause. So what is the cause? So frequent urination is one cause. So triggering factor. It must be a cause or a triggering factor. So a cause or a triggering factor. Okay. So identify the cause or identify the triggering factor. So exacerbated because of, by something and something. So it must be something that worsens the sleeplessness. Worsens, exacerbated means worsening. Worsened by. Condition was worsened. Okay. So worsening sleeplessness. So the factors, the causes which are worsening the condition. Now, this is not a medical condition. Okay. It cannot be a medical condition. It cannot be a body part unless phrased as a cause. See, for example, if it is phrased as a cause, it can be a medical condition also, right? So, a body part, a type of food, an adjective, a treatment. No, all these are not. So, it is a reason or a cause or a trigger, right? Now, let us see. Worsened by what? It may be stress and frequent urination, okay? Or work pressure, or it may be anxiety, or it may be shift work, or it may be pain, or it may be itching, or medication side effects, or it may be worrying, or hot flashes, or you can say caffeine consumption, or noise, or discomfort at night. Okay, so this gives you a strong predictive pool. Now connecting with the context of the patient. So he has generalized fatigue, earlier symptoms, generalized fatigue. Then he had partial loss of taste, you can see later, partial loss of taste. And then you have the itchiness. Okay, in the next point number 5, itchiness, coordination. Itchiness mostly affected nose and skin. So itchiness, persistent ulcer, suspected anemia. So all these are the points. So the most likely chances are stress, so fatigue, sleeplessness, anemia. So fatigue plus sleeplessness plus anemia often report what? Maybe stress. Okay. So normally the most likely operation is, so stress, worrying, frequent urination, itching, nighttime discomfort, pain, and there is another word, restlessness. Restlessness, anxiety, similar to that. Restlessness. So we can add one more word here, restlessness. Restlessness. Okay. We can add one more word. Okay. Now, this means first dash must be something different, not repeated. Okay. Not repeated. It should not be generalized fatigue. It should not be sleeplessness. It should not be frequent urination. It should not be itchiness. Okay. It should not be all these things. It should be something different. So, any bathroom related cause, no, because already frequent urination is bathroom related. So now the most correct options, authentic OET materials might be stress. The most likely chance is a stress. Or you can say anxiety, mostly, or worrying, or nighttime itching at night. Okay, mostly. So Carcina had itchiness, multiple health concerns. So we already know. So itchiness is there already. So itchiness again will not come. Okay. Itchiness is already there in point number 5. So no need that one. So the two strongest logical triggers become stress and itching. Right. Itchiness. This itchiness from here mostly affected nose and skin around. So itchiness from here maybe, or stress. So most likely stress, otherwise itching. Itching because this itching may be carried down here. Itchiness mostly affected nose and skin around. Those both options might be right. Stress and itching, right? Both are commonly used, right? Now, so this dash tells you that this question is asking what exacerbated the sleeplessness. So the answer is a single word and a short cause. So not a long phrase, not a condition name. So 1 to 2 words. So first guess is stress. Second best guess is itching, anxiety, and worrying. Itching, anxiety, and worrying. Itching, anxiety, and worrying. Okay. So these are the options. So this is the way how you have to. Yeah. Winter screen. So we had the third answer. Question 3. Yes. So next we will go for the fourth answer. So fourth. Fourth question. Go through this one. Yeah. So fourth question. Yeah. Partial loss of taste. Dash foods affected. What type of foods? So this is type, adjective. Okay. So partial loss of taste. Dash foods affected. You must guess what type of foods. So type of foods. It is type of foods. What type of food? So type of foods. What type of foods? Okay, affected. So type of foods affected. So what type? So it's an adjective. It's an adjective. You are guessing for an adjective. So you are getting an adjective, a food type. You're going to guess for an adjective. Focus on the adjective. Right. Partial loss of taste. Partial loss of taste. It's a type of food affected. What type of food? It's an adjective describing a food category. What category? What type? Okay, what class of food? Is it spicy foods or salty foods? A food type. It cannot be a symptom. It cannot be a medical condition. It cannot be a cause. It cannot be a noun that doesn't describe food. It's a food characteristic. So now if you see, listen for an adjective to describe food. Food. Exactly one descriptive word, maybe one or maybe two. Okay, one word or short two words, usually a short phrase. So the answer must be exactly one descriptive word or a short phrase, usually one or two words. Now this may be spicy. Foods is already there, so spicy. So the options might be like this. Spicy. Or you can say sweet. What category? Sweet foods. Or salty foods. Or bitter foods. Or bland with tasteless, bland, savory, or sour. Okay, these are the, okay. Then if you use medical logic, which taste is often lost? Which taste is often lost? It may be, so another type like B12 deficiency. B12 deficiency. Okay, or iron deficiency. Or you can say anemia. Oh. Sorry. So let me rewrite. So we can say spicy. And then what's the next? Sweet. Then salty or bitter or bland, savory or sour. These are one type of foods. Okay. Next, another type, if you see, so patients, if you use medical logic, which taste is often lost? That is B12 deficiency. Or you can say iron deficiency. Or you can say anemia, post-infection fatigue. So taste is often lost, medical logic. Okay, patients who have these conditions, Which conditions? People who have B12, these are the conditions. Under what conditions? So these are the different types of foods, and these are the conditions when people lose. So medical condition, you can say medical condition. Okay, lose taste. In these medical conditions, people lose the taste. So post infection stage. Post-infection stage, post-infection fatigue, you can say, or neurological issues. People with neurological issues, they lose taste, or you can say taste disturbances. So these are the medical conditions where people lose taste. Okay. These are the medical conditions in which people lose taste. And these are the different types of taste. Okay. Sweet, salty, spice. Most commonly reported in clinical context are, okay, spicy foods, sweet foods, and salty foods. Most likely spicy or sweet and salty. These are the three different tastes. Most likely, okay, people lose taste. Okay, hard foods, uncommon, but as a taste discriminator, bitter foods appears rarely. And as now you see, she has generalized fatigue. You know that. She has generalized fatigue. Okay, and she has sleeplessness, she has ulcers, she has itchiness, she has suspected anemia, she has partial loss of taste. So most likely answers sweet and salty. So the most likely answers are sweet and salty. These are the most likely answers. Next best is spicy. Okay, taste sweet foods and salty foods. Because of these, okay, spicy is less common. Okay, spicy is less common. Top strategic guesses. Top most is the sweet. Then next second is salty and spicy. Right? So 4 questions we have done with now. We have done with 4 questions now. Right. This is question number 4. Yes, this is how you have to guess the answers. That's very, very important. That's very important. So this is the 4 questions. I have given you 4 questions. How you can guess? How you can guess? Okay. Right. 5th question. Next question is 5th question. Began to feel. So verb will come. Feel something. Feel or adjective will come. Feel cold. Began to feel cold. Begins to feel irritated. Adjective. Okay. Cold. So most likely adjective. Feeling of adjective. Began to feel dash. Loss of grip and coordination. Feel helpless. Okay. A type of feeling. A type of feeling. Okay. Type of feeling. Here. Feel. Type of feeling. Type. Type of feeling. So what type of feeling is it? So this is most likely an adjective. Okay. An adjective. So same like previous question. Is an adjective. So began to feel irritated, like that. Okay, began to feel. So this is a physical sensation. It's a sensation, physical sensation, feeling, a physical sensation. So you can say it's a physical sensation or physical sensation, right? It's not a noun like weakness, okay? A body part, no. A type of food, no. A cause, no. A medical diagnosis, no. It's a category, a feeling describing clumsiness or unsteadiness, because loss of grip and coordination. Loss of grip, not steady. Grip is not steady. It's a clumsy. So clumsiness or unsteadiness. So feel clumsy or unsteady, maybe. So it's a feeling of describing clumsiness or unsteadiness. Okay, is a feeling, a sensational. Yeah. So what might be the words here? So feel clumsy movements. Okay, clumsy movements, maybe. Clumsy movements, maybe. Shaky hands. Began to feel shaky hands. Okay, unsteady fingers. Okay, or feel difficulty holding objects. Okay, so this suggests these things. The suggestion is this. So clumsy movements or shaky hands, right? So the conditions. So what might be feeling? So feel being unsteady or being clumsy, feel being clumsy or feel being shaky. So these are the words which might be being wobbly or lacking control. Feel lacking control. So now the words most common are clumsy, shaky, unsteady, trembly, or wobbly, or fumbly, or slippy. So these might be the option word, feel unsteady. Okay. So you can take the words directly from these. So unsteady might be one possible option. Clumsy might be another option. Okay. Shaky might be another option. Trembly, feel trembly. No, that is less common. Wobbly. Okay. Fumbly, sometimes used informally. Fumbly or slippy, rare. So these are the most right options which we can think. So trembly, maybe, but not very common. Or fumbly, okay, but less common. Sometimes used informally. And slippy, but rarely. Or so the most appropriate options are the first one. Clumsy is the best option. Clumsy is the best option. Shaky and unsteady also maybe. Okay. Clumsiness. The most natural adjective, clumsiness, unsteady movements, peripheral neuropathy, loss of control of grip, then we can say clumsy is the best option. Unsteady and shaky are the next best options. Unsteady and shaky are the next best options. So the most appropriate answer is clumsy for question number 5. clumsy. Right. So now with this, we'll move on to the next one. Yeah. So question number 5. That is question number 5. Next question number 6. Question number 6. Okay. Question number 6. Itchiness. Itchiness. Mostly affected nose and skin around dash. Mostly affected nose and skin around some body part. So which body part the itchiness affected? So one is nose. The second one, skin around another one, not nose. Nose is already mentioned. Maybe ears, maybe mouth, maybe eyes, okay, maybe neck, or somewhere like that. So most likely around the eyes or around the ears, okay, around the mouth or lips. So a body part, most likely a body part, itchiness around dash. Nose is already there and around dash. So this is body part. So which body part? Which body part? What is that body? You have to listen for that body part. It's not an adjective, it's not a condition, it's not a feeling, it's not a verb, it's not a cause. It's a body part. Skin around. Which body location? Body location. Itchiness. So nose. He already mentioned itchiness, nose, skin irritation. So nose and skin around. Skin is already there. Nose and skin around. So nose is affected. And skin also is around. Skin where? Which location? Around the, which location? Which nose? Which face or body part? So close to the face. So this implies the second location must be close to the face or a commonly itchy area or a small specific anatomical site. Now, so body parts are symmetrical. Okay, example, nose plus eyes or nose plus mouth or nose plus ears. Remember these things. So symmetrical, nose plus eyes or symmetrical. Nose plus eyes, symmetrical. Then next one, close together, nose and mouth. They are close together. Are part of a system, nose and ears, ENT, ear, nose, throat. Okay. So part of a same system, nose and ears. So these may be the answers, maybe the listening frequently uses normally eyes, mouth, like that. So which body part or which location? Okay. So it may be eyes or mouth or lips, ears, chin, scalp, or neck. These might be the option. And nearby, so, or easily itchy, or commonly affected by allergies or skin dryness. The most likely answers are eyes, mouth, lips, and ears. Eyes, mouth, lips, and ears. It cannot be around the stomach. Okay, legs, arms, shoulders, back. Normally, not it's skin around. So don't match this natural face. Nose is okay far away from stomach, and legs and arms and shoulders and back. So scalp, no, not around. around the scalp is not right. On the scalp, not around the scalp. So chin, possible but less common. So the best candidates, best options are eyes, mouth, lips and ears. Eyes, mouth, lips and ears. These are the most likely options. Okay, nose is already given. If your logic match clinical logic, anemia, Carina has anemia, Carina has pregnancy, possible allergies and skin irritation. So eyes, allergy pattern, lips and mouth, eczema and dryness, ears, eczema. But when OET pairs nose plus dash, so normally the overwhelming frequent combination is nose and eyes. The most likely combination is nose and eyes. So for example, they occur together in hay fever, sinus issues, dermatitis, allergic reactions, dryness, pregnancy-related histamine changes. So in all these conditions, so eyes are affected along with nose. So OET loves to test allergy type symptoms. So the top strategic guess is eyes. The top strategic guess is eyes. Okay, next comes mouth, lips and ears. Those are other options, right? So this is how you have to normally guess. Next, seventh question. So seventh question. Yes. Question number 6. Yeah, next question is question number 7. Yeah. Question number 7. Yeah. Persistent ulcer on dash. Persistent. Okay, continuous. Persistent, going on. Ongoing. It's continuous, prolonged. It's not healing, it's going on. Too much. Persistent ulcer. It's not even coming and going. It is continuous, long standing. So that's it. Persistent ulcer on dash. On. So body location of the ulcer. So body location, body part or body location. Or body part. Where exactly? Where is that? On which area or which part of the body? So ulcer on suggests a specific body part, a particular body part. Okay. It's not a symptom. It's not a condition. It's not an adjective. It's not a cause. It's a specific body location or body part. Now, ulcer, where? Okay. It might be the lip, the upper or lower lip. One location. The lip, the upper lip or the lower lip or the tongue or the mouth or the gum, the gums, maybe a gum, the foot, the left foot or the right foot or the left leg or the right leg, okay, or the legs. Persistent ulcer, only one ulcer, not ulcers. So only one location. Okay, the right leg not both the legs. Okay. So persistent ulcer, not ulcers, singular. So the right leg or the left heel or the right heel or the shin. Okay, these are some options. Okay. Now, mouth areas, oral ulcers, legs, feet, venous or diabetic ulcers. So, Karina's best case. So, which fits the best case? Now, Karina's other symptoms are loss of taste, fatigue, anemia, itchiness, persistent ulcer, B12 deficiency, and pregnancy. So pernicious anemia, for example, B12 deficiency. B12 deficiency is there. B12 deficiency is there in the later part of this. Okay, so it is pernicious anemia. So it may be mouth ulcers or tongue ulcers or lip ulcers or burning mouth or glossitis or mucosal sores. It does not typically cause leg ulcers, foot ulcers or skin ulcers elsewhere. So it may be ulcer on my tongue, ulcer on my lip, or ulcer on the inside of the mouth, or ulcer on my gums. So most frequent is ulcer on my tongue. So tongue. So tongue is the most frequent option here because patients naturally say this when describing painful ulcers that won't heal, persistent ulcer won't heal. So not healed. Okay. Not relieved of the pain, not relieved of the problem. So tongue is the most common answer. Other options are lip, gum, and mouth. Lip, mouth, and gum. So tongue is the best answer for this. Okay. Yeah. Question 7. So we have done 7 questions so far. Right. Next. So next question number 8. Question number 8. Question number 8. Okay. Iron deficiency suspected follows a dash diet, a type of diet, type of, a dash diet, type of diet. What type of diet is this? Okay. Iron deficiency suspected follows a dash diet. Okay. A diet which causes iron deficiency, a type of diet. So predict what type of diet Karina follows that could cause iron deficiency. Okay. So low iron intake diet, maybe. So a diet known for low iron intake. So it cannot be a symptom. It cannot be a condition, a feeling, single food item or behavior or cause not related to that. It's a named diet pattern, dietary pattern. So exclude meat. So meat, no meat, or limit animal products. Iron deficiency. Iron deficiency may be there if you exclude meat. So Carcina might have excluded meat. Exclude meat or limit animal products. So when you do this, okay, reduce hemi iron intake. Reduce hemi iron intake. Okay, these are the things. which if you do these things, if you exclude meat, then iron deficiency may be there. Animal products, iron deficient. So iron intake. So these are the reasons why you may have iron deficiency. The condition iron deficiency. Okay. Now, what type of diets can cause iron deficiency? The most common diets causing iron deficiency are, so vegetarian diet. If you take vegetarian diet, you may have iron deficiency. Then vegan diet, that's the second. Plant-based diet or low iron diet. So already diet is there. Okay. So no need diet again. Vegetarian or vegan or plant-based or low iron, or this uncommon phrase, but still. So organic diet, no, not related. Okay. Not related. Gluten-free diet, no, not related. Keto diet, no. High meat. Keto diet has high meat. Okay. So, first three options might be right. Vegetarian diet, vegan diet, plant-based diet. These may be the right options. Low iron is uncommon phrase. And organic diet, not related. Or gluten-free, no, not related. And keto diet. Keto diet is high meat, so no. Keto diet is high meat, so no. So the most likely options are these three. And these are not possible. Not likely because they are not related. Keto is high meat. And low iron, organic and gluten-free, they are not related. Okay, this is high meat, so this also ruled out. Okay, so all these are ruled out. So these more likely chances, vegetarian, vegan, and plant-based. So the realistic choice is narrow now to vegetarian, vegan, and plant-based. So they should be simple, common, immediately understood, and medical relevant to iron levels. So Carina has iron deficiency suspected, we know that. Diagnosed pernicious anemia. Pregnancy, you know pernicious anemia. Yeah. So here, revealed pernicious anemia here. Blood test revealed pernicious anemia. So she has pernicious anemia. So that is one. B12 deficiency. B12 deficiency we can understand. And pregnancy and taste disturbances. Carina has these problems. Pregnancy problems, taste disturbances, fatigue, all problems she has. So people with vegan and vegetarian diets are at increased risk of both. So iron deficiency and vitamin B12 deficiency. So these two. Now the strong linked with vegan diets. So B12 deficiency is much more strongly linked with vegan diets because B12 is almost exclusively found in animal products. Okay. So OET often sets up the story like I have been on a vegan diet for years leading to B12 deficiency like that. So the best guess, okay, between vegetarian and vegan, okay, mostly vegetarian, but vegan also is possible, okay. Between vegetarian and vegetarian because it's more common globally, but when patient later shows severe B12 deficiency, so most likely it is a vegan diet, most likely vegan diet, most likely. Then vegetarian also is an option. So top strategic guess, because it's a global pattern, okay, global pattern. If you see, it's vegetarian. So vegan diet, very few are there. So maybe vegan, very few. So vegetarian mostly. So first priority is vegetarian and second priority is vegan. Okay. Next. This is how you have to analyze the questions. Yeah. Question number 8. Question number 8. Yeah. Question number 9. Question number 9. Question number 9. 4 more questions. Dash ruled out. Blood test revealed pernicious anemia. Something ruled out because blood test revealed pernicious anemia. Okay. Now, which coordination? Now, if you see this coordination here, something is ruled out. Why? Blood test revealed pernicious anemia. Okay. Now, which condition was ruled out? Before the doctor confirmed pernicious anemia. So, the likelihood, relation. So, the answer must be another medical condition. Pernicious anemia is one medical condition which was diagnosed. So, what was eliminated then? Okay. So, that also will be a medical condition. Okay. Because pernicious anemia is a medical condition. So, another condition was ruled out. So, this is a medical condition. So, both are medical conditions. One medical condition is ruled out, and the second medical condition is confirmed. Okay, diagnosed. So it is not a symptom, it is not a behavior, it's not a treatment, it is not a blood test name. It's a medical condition, and the medical condition that resembles pernicious anemia. So they are more likely if this, otherwise this. If it is pernicious anemia, this is not this. If this is right, then it might not be pernicious. So any one condition only, both cannot be right. So one is ruled out, so the other is confirmed. They are related. So now it might be two-word medical condition. Okay, it might be two-word medical condition. Now you have to write the full name and not an abbreviation. You have to write the full name, a medical diagnosis, exactly 2 words, a medical diagnosis, eliminated, often abbreviated, known to be confused with anemia. Sometimes it may be confused with anemia because they are related there. They are related. So therefore, eliminate iron deficiency, 2 words, but not hard to spell. Okay. So folate deficiency, easy to spell. Folate deficiency. Okay. Eliminate these things. Celiac disease, not 2 words when spoken with disease. Okay. Without disease, 2 words. B12 deficiency, not tricky to spell and too obvious. Thyroid problems, not 2-word medical name. So the options. Doctors often rule out these before diagnosing pernicious anemia. They will rule out these medical conditions before diagnosing pernicious anemia. So, celiac disease. Okay. Celiac disease, often spelled celiac, or Crohn's disease, or ulcerative colitis, or autoimmune gastritis, or gastric atrophy, or stomach ulcer. So 2 words, a simple spelling. But which are 2 words medical and hard to spell? Okay. So celiac disease, spelling tricky. But OET usually counts disease as part of the name. 2 words. Autoimmune gastritis, maybe. But we need the one that OET usually sees more often. So celiac disease, Crohn's disease, ulcer disease. This frequently. So often misspelled is celiac disease. Okay. Celiac disease ruled out, maybe chances. Because different spelling in UK Australia, confusion. Okay, many students miss the spelling. And 2 words, celiac disease. So Carina has B12 deficiency. She has ulcer, she has taste loss, she has fatigue, she has pregnancy concerns. Before diagnosing pernicious anemia, doctors commonly test for celiac disease. That's because it causes malabsorption, it causes anemia, it causes fatigue, it causes GI, gastrointestinal symptoms, it causes B12 deficiency signs. So this makes it the most logical guess. What? Celiac disease. Second best cases are Crohn's disease, autoimmune gastritis, and ulcerative colitis. So the most likely option is celiac disease. Because this is related to, yeah. Before diagnosing pernicious anemia, doctors commonly test for celiac disease because of the various conditions it causes, like malabsorption, anemia, fatigue, and GI symptoms and B12 deficiency symptoms. That is the reason why. Yes, 9th question done. Question number 9. Next. Yeah, question number 10. Question number 10. Question number 10. You see, question number 10, began to experience dash by week 9. So week 9, 9th week. So experience some symptoms. Began to experience some symptoms. Okay. Began to experience symptoms by week 9. So what are those symptoms that she began to experience? Nausea maybe. What exactly are the symptoms that a pregnant lady might experience on week 9, in week 9, during week 9 or by week 9? Okay, it is a symptom. She began to experience certain symptoms by week 9. Okay, before week 9. By means before. It's not a diagnosis. It's not a treatment. It's not a cause. It's not a body part. It's not a food type. It's not a lifestyle factor. She began to experience some symptoms. A symptom the patient can feel. Okay, it's a category. A type of symptom the patients can feel. So listen for 2 words here. Exactly 2 words. A symptom. Something with a common layman name. Okay, because she is telling here. The patient is telling, not the doctor. Patient is telling. Began to experience. Who began? The patient will tell, not the doctor. So patient feels and patient will tell. So what some people call like pins and needles. Okay. Symptoms like pins and needles, pricking sensation. Okay. So identify symptoms commonly introduced with what some people call pins and needles. Some conditions, some introduced with. So pins and needles, restless legs, or sciatic pain. Next, chest tightness, less common, but still chest tightness. shooting pain, or hot flashes. So these people may say pins and needles, or restless legs, or sciatic pain, or chest tightness, or shooting pain. Chest tightness is little less common, and shooting pain and hot flashes. The most famous everyday phrase is pins and needles. Okay. Most commonly used pins and needles sensation. So classic OET pattern. So you can common neurological symptoms here. You told it a B12 treatment. Here you see B12 treatment. So B12 deficiency. Daily B12 supplements initially. You can see here B12 supplements. Daily B12 supplements initially gradually reduced to 11-week intervals. So B12 supplements. So this is something B12 deficiency, B12 treatment. You can say B12, B12. So this is related to neurological symptoms returning. Neurological symptoms. Common neurological symptoms of B12 deficiency. Neurological symptoms of B12 deficiency. So most likely we can say, we can quote them like this. So we can give those words. For example, pins and needles, or numbness, or tingling sensation, or burning feeling, or dizziness, or balance issues, or you can say clumsy hands, or electric shock sensations, electric shock sensations. So of these, the most common one might be pins and needles. Pins and needles. Okay. Began to experience pins and needles. Most likely option. So you have to analyze. Okay. So layman phrase rule, 2-word rule, or neurological symptom return rule, or the OET uses training materials. Okay, pins and needles mostly. So the second best cases are restless legs and shooting pain. But pins and needles matches every clue perfectly here. Yeah, now let us go to 11. Let us go to number 11. Question 10. Next question, number 11. Question number 11. Question number 11. Yes. Question number 11. Yeah. So, pregnant. You know, she's pregnant and she's taking something. Supplement, taking dash. Supplement. In addition to folic acid, another supplement. In addition to folic acid, she's taking full. She's pregnant. she's taking folic acid, and in addition to that, she's taking dash supplement in addition to folic acid. So she's already taking folic acid, and she's also taking some supplement, maybe iron supplement or something like that, a supplement. Okay, she's taking a supplement. She's taking a supplement, dash supplement. What supplement? What supplement? Okay, instead of something, she's taking supplement. What is that? So it's not a food, it's not a medicine, it's not a symptom, it's not a condition, it's a nutritional supplement. It's a nutritional supplement. So nutritional supplement. Okay. It might be a nutritional supplement. Now here, she is pregnant. She has pernicious anemia, that means B12 deficiency. So she is on B12 injections, we know. Previously had iron deficiency and now on B12 injections. So common supplements taken during pregnancy include, what are the common supplements taken during pregnancy? First one is iron. So iron supplement or vitamin D supplement or calcium or omega-3, or you can say iodine and B12, multivitamins. Okay, so here, you know, these are some supplements taken during pregnancy, and those are iron, vitamin D, calcium, omega-3, iodine, B12, and multivitamin. But the question already has a clue. She is taking this in addition to folic acid. So folic acid, the supplement must be one that it should be safe during pregnancy and commonly recommended and often paired with folic acid. So relevant to anemia or B12 issues. So now here most likely is iron supplement or vitamin D supplement or B12 supplement or pregnancy supplement. So this is here Carina already has anemia related issues. The exam tends to choose a supplement that relates to pregnancy plus anemia. So this strongly points to iron supplement. This strongly points to iron supplements. So these are the things. So she has pregnancy plus anemia. So iron. So the strongly points out pregnancy and anemia. Both. She is undergoing pregnancy. Okay. She has anemia. So both these things are there. Conditions, medical conditions. So the strongly recommended answer should be iron. So iron supplement. The most likely option is iron. Taking iron supplement. Yeah. Iron supplement in addition to folic acid. So question number 12 next. Yeah, last option. Question number 12. Yes. Question number 12. Concerned about risk of calcium is also one option, and vitamin D also is one option, and B12 is already there. So question number 12. Concerned about risk of dash in child. So child after conceiving. Okay. So she's carrying pregnancy. Okay. Process of delivery. So concerned about risk of dash in child. So if she takes something, okay, she is concerned about risk of dash in child. So requests a dietary advice. She thinks that the child may face a particular risk. Okay, maybe danger, problem. Okay. So some medical risk to the child. So Carcida, sorry. So you have to predict what medical risk Carina is worried her baby might have. Now, step one, identify the answer type. This is a medical condition which the baby might have. Okay. So it's not a symptom, it's not a nutrient, it's not a behavior, it's not a lifestyle factor, it's a category, is child health risk related to mother's condition. So mother has pernicious anemia, that is severe B12 vitamin deficiency, had iron deficiency, currently pregnant, suffered from neurological symptoms, clumsiness, pins and needles. So needed supplements. So vitamin B12 deficiency in pregnancy is linked with neural tube defects or developmental delays. So in this condition, you see vitamin B12 deficiency in pregnancy. She has vitamin B12 deficiency. Okay. She has vitamin B12 deficiency. So now in pregnancy, this deficiency is linked with some conditions. And what are those conditions? Neural tube defects or developmental delays or anemia in the baby or low birth weight or cognitive issues. Rarely, but still chances are there, but rarely stated. Cognitive issues. So these are some options. These are some options. So the most common risk pregnant women worry about is neural tube defects. The most likely is neural tube defects. Risk of neural tube defects in child. So that's the reason why she is requesting dietary advice. Okay. Now let us see anemia, child at risk of anemia. Then deficiencies, child at risk of B12 deficiency. Low birth weight, less common wording. And development issues, rare. Neural tube defects, common but technical. So easy to hear, easy to write, related to mother's nutritional problems. Simplest option is anemia. Okay. The simplest option is anemia. Sorry. Okay. Anemia. This is relatable fear many pregnant patients express. Also, the question says request dietary advice. When mothers worry about neural tube defects, they don't ask for dietary advice. They ask for screening. But when they worry about anemia, they do ask for dietary advice. Anemia, dietary advice, like iron, B12, folate foods. So this is perfectly aligned with the prompt dietary advice. So for example, if it is related to neural tube defects, they will ask for screening test. They will not ask dietary advice. So she's asking dietary advice. Why she's asking dietary advice? Because she's not concerned about neural tubes defects, but she's worried about anemia. That's why she's asking dietary advice. So relate dietary advice to anemia. So anemia in the baby. Okay. So most likely option is anemia. Right. This perfectly aligns with the option anemia. Second best guesses are B12 deficiency or iron deficiency or neural tube defects. Medically correct, but less likely for OET here setting. But based on dietary advice, link, simplicity, OET pattern frequency, and maternal history, and the easiest to hear condition, the strongest prediction is anemia. Right. So we have completed all the 12 answers. So we have Odeon here from the beginning to the end. Odeon, it needs patience. Okay. We don't need to do hundreds of tests. Okay, one test, proper learning, is enough to practice the rest. So 12 questions we have done so far. Odeon, yeah, you are there till the end. Yes. So come on, Odeon. Yes. You can share your experience. Show meeting. Yeah. Hide meeting. Yes. So Odeon, you can unmute and you can speak. Tell me. Hello? Can you unmute?
Hi.
Hello, dear Odeon.
Yes, sir. Good morning, sir. Oh, good
Yeah, how
afternoon.
is the session? What did you learn?
Yeah, I learned so much from your explanation on how to go about getting the answers to this listening question 1 to 12. You actually break it down into such a way that one can easily understand, like especially the brainstorming part of it. You have to think before you write. You have to look at it, read it, and then try to fix what is supposed to be in that answer before you can actually write it. So it made me to understand this very part so much that, and I could give it a try anytime and I'll be able to get correct answers to it. Thank you for your time. Thank you.
Yeah, that's very nice. So we will meet in another session. So if you are interested, anybody, you can contact me for a regular batch and session. So this is my contact number. Contact the admin. Okay, and the number is +91 98 67360. Yeah. So that's it. So this is my number, +91 98 778 67360. So this is my number. You can contact me. New batch starting next week. New batch starting next week. If you are interested, you can contact me for regular sessions. So we have special UK batch, and then we have morning, afternoon, evening, and night, 4 separate batches. If you are interested, you can contact me on this number on WhatsApp or Telegram. See you again in our next session. Thank you. Like, share, and subscribe. If you have liked this video and it helped you a lot, please like, share, comment, and subscribe.